801 and a half. All right. Good morning, everyone. Thank you so much for joining our second practice managers meeting of the year. As I mentioned, we do have a full agenda, but before we get started, please do not forget to put your name and your practice representation in the chat, just so that we have that for attendance and citizenship for this year's reward plan. So I'll move right into the presentation. We're going to start with a couple things, just notable additions and departures for the AHP network. We haven't done that in a bit of time, so I think it's important that we kind of touch on where our network is. And then, as I mentioned, we do have some speakers today. We have folks from the UR Imaging Sciences Department, and then also from Medline joining us. So they're going to give us some presentations here at the top of the meeting, and then we'll move into some internal stuff with clinical initiative updates from our optimization team, and then touch very briefly on upcoming incentive payments, and maybe we'll have some time for open discussion. I'll remind you all at the end, but if there's ever any topics that you're interested in hearing about in this setting, or you have any questions for our team, you can always reach out to Molly Parmiter. And we can start, taking note of those for future meetings. So on to network additions and transitions and departures. As you know, from time to time, we have movement in the AHP network. And so I like to update folks on that. We have some practices that are joining AHP. So we've got Soul Skin and Surgery. This is the dermatology practices out on the west side. Jackson's Health, their NPs practicing in Brighton, primary care, Lakeside Foot and Ankle, who is a podiatrist out in Victor, and then the Guthrie Clinic, which we'll talk about a little bit more on the next slide. And then some changes. A couple practices were acquired by other groups. So these physicians are still in the AHP network, just not practicing in independent practice. And then we have some folks who have retired and left the network. So we've had a lot of change over the last 6 or 7 months, so I thought it was important to just bring you guys up to speed there. As I mentioned, I touched on the Guthrie Clinic. So this is a large group for us. So in 2024, Guthrie is going to be joining, and they are bringing with them a lot of growth for the AHP network. And so I thought it would be important to just hit on what that really means. With Guthrie's addition in 2024, we'll be about 2.5 times the size that we were in 2013. And so for those of you on the call who have been with us that long, we started off as a very small team, small group, and we've grown significantly. So Guthrie is actually going to be adding 5 hospitals in addition to Lourdes, which they recently acquired. We're currently sitting at about 400,000 contracted lives. And that's nearly 1 million patients who are cared for by providers in our network. So we have grown quite a bit. This also means that we're now going to be 10 healthcare systems, 16 hospitals. So again, just tremendous growth there. But what does that mean for our footprint as well? 2 states. Guthrie's headquarters is in Pennsylvania, and we will now have practices in 2 states, New York and Pennsylvania, and we will also be in 29 counties. So obviously AHP staff is not in 29 counties, but that does mean we have providers in 29 different counties across 2 states. And that just speaks volumes to the work that we've done in quality and cost and really making a difference for community and population health. And I say all of this because thank you. All of you groups here have been the reason and the driver for this success. Your dedication to high quality patient care has really allowed us to support this kind of growth, to attract new providers in the community space. And we are just very, very, very proud of that work. So a huge thank you to all of you on this call and people who will watch the recording who have been, integral in us having this growth that we've had. So that's my very brief spiel. And thank you note to you all before we kick it over to some of our speakers. So as I mentioned, we do have folks from the UR Imaging Sciences Department, Kylie Candelaria and Cheryl. Oh, Cheryl, I don't want to butcher your last name, but I think I've got it right. Mazurkowitz. Is that close?
That is
Good.
100% right. Good job.
Nice. I even went through it phonetically from the last time we talked, so I'm glad I got that correct. So I'm going to kick it over to you all, and I know I'm running your slides for today, so just let me know how you want me to advance.
Great, thank you. I'll start us off. Good morning. Again, as Jana mentioned, we are from UR Medicine Department of Imaging Sciences, and we appreciate your time this morning. Wanted to give you an update on some of the new things that are happening in imaging, and hopefully be able to answer any questions that you may have later on. If you do, however, have any questions as we're going through the slides, please feel free to raise your hand, to interrupt, to throw questions in chat. And if I don't see them, hopefully somebody else can bring them to my attention. And again, so anyway, get started. My name is Kylie Candelaria. I am the Director of Business Development for Imaging Sciences. And Cheryl Mazurkowicz, which Jana did pronounce correctly, is our regional administrator, and she's also on this call. And will be adding any information she sees fit here and there. Next slide, please. So just to start, wanted to just put a name and face together for you. Dr. Jennifer Harvey is the chair of Imaging Sciences, and then Dr. Verdi is our regional director for Imaging Sciences. Next slide, please. So continuing with our overview, I just wanted to mention that we do have a number of radiologists who work in our department, and they're all fellowship trained and subspecialized in the following areas. So we have providers that specialize in abdomen, breast, cardiothoracic imaging, emergency imaging, MSK or musculoskeletal imaging, neuroradiology, pediatrics, vascular and interventional radiology, and then we have a department of research as well. And I did want to highlight diagnostic, that we have both diagnostic and interventional radiology. I want to just take a second and talk about the difference between those two. Would you mind going back, Jana? Thank you. So diagnostic radiology is the providers who are actually just doing the reads. So, the patient comes in, they're having their imaging done, and then the radiologist is going to read those images and come up with a diagnosis. Interventional radiology is a little bit different in that those radiologists are actually performing procedures to help with a disease process. And we'll talk a little more about that later. So going through the imaging modalities that we offer: X-ray, ultrasound, CT, CTA, GI, mammography, both screening and diagnostic, MRI, MRA, nuclear medicine, and PET-CT. In addition to providing imaging and interventions, we also have two programs that fall under our department. And the one is our mobile screening mammography unit. And in September of 2023, I just lost my train of thought. Sorry. We not only purchased but opened our mobile mammography unit, which we call the MammoVan. And you may have seen that. You may have hosted it. And if you are interested, though, and haven't heard more about that, I'm happy to have any conversations further about it offline. And my contact information will be up later. We also have the lung cancer screening program, which is a combination of imaging, the Department of Medicine, and the Wilmot Cancer Institute. Those three departments came together for this very, very important lung cancer screening, which we have a number of locations and a number in the region to help with that initiative. Next slide, please. So as far as diagnostic imaging goes, we have 4 different locations in the region. And more recently, FF Thompson has been added to that list. We also are imaging at Noyes, St. James, and Jones Memorial. Our clinics for interventional radiologists, or for interventional radiology locations are at FF Thompson, Noyes, and St. James. We do interventional procedures at FF Thompson and Noyes. So the same procedures that can be done at Strong are now available in the region, which is really great. So the patients, your local patients, can stay local. And then vascular care at FF Thompson and Noyes is managed by interventional radiology in collaboration with vascular surgery. Next slide. And this is just a map to give you an idea visually of our different locations. Of course, the square is Monroe County and our Monroe County locations. And then, all of our regional locations are listed with the little red map. These also have our urgent care locations. Next slide. So I wanted to talk a little bit about patient and provider satisfaction. As we know, the pandemic posed many challenges in healthcare, and most of which were getting patients seen, right? And getting their imaging done just in general. So because patient visits were so limited, we had quite a backlog coming out of the pandemic and getting patients, seen in a fair amount of time to get their, CT scans, their MRIs, that sort of thing. So we had a pretty good backlog of, patient wait times to be seen for these exams. So once the world opened, we were able to do some things in an effort to get patients in and seen and, help facilitate their medical care. Some of those initiatives included extending hours. So we added nights and weekends. We upgraded equipment. For example, our MRIs, we did a lot of upgrades to decrease the scan time so we could get more patients seen within an hour. We went from about 2, maybe 3 patients an hour to 4 and sometimes 5. In addition, we did quite a bit of recruitment and onboarding of radiologists. In 2024 and 2025, we're looking at a total of 16 new radiologists. And then 2 that I wanted to point out because they are going to be, are in the region. Dr. Kamasan, diagnostic radiologist who started a few months back, and then Dr. Hoonjan, who starts in July. He is an interventional radiologist. In addition, we opened the Imaging Information Center, and that is a great resource, especially for this group. This is a department that is open 24/7, so 24 hours a day, 7 days a week. And you can use this department for things such as like radiologist consults. So if your provider wants to speak to one of our providers to discuss a case or a read, that's one way of getting hold of the radiologist. If you're looking for an imaging release request, you can call that number. And then if you're, calling to, maybe get a scan moved up, you need something read sooner, or you're, there's a critical or significant finding that your office would like to inquire more about, this is a great department to utilize. In addition, we have increased radiologist read efficiency by utilizing AI. And then we've also established an ABIR regional call program. Next slide. Oh, go back, please. Okay, sorry about that. I think we're missing something here, but let's see, just looking through my notes to make sure that we're not missing anything. Okay, I just wanted to point out the ABIR acronym. That's Affiliate Vascular and Interventional Radiology, and that is a regional program that we've established to bring interventional radiology to the hospitals that I had mentioned in the region before. Well, Cheryl, did you have anything to add?
Yeah, thanks, Kylie. I just wanted to address, I think, what is on a lot of your folks' minds, I'm sure, and that is the reading backlog, and for lack of better words, the delays, in turnaround time. As she mentioned in the slides, there has been an incredible effort, by the enterprise, Imaging Sciences Enterprise, to onboard new radiologists. The difficulty with that is it takes a little time from the time of recruitment to onboarding. So the bulk of the new hires will start in July. I do expect that you will see significant turnaround time improvement starting in July and August. Please know that we understand that this has been a source of contention for everyone, and it has been the number one priority that we are working on. They did have, we went through the series of things to make access better, and then we also had to, at the same time, balance how to get, while that increase in volume with access, how do we balance getting it read in a timely fashion? And there's been an incredible amount of resources added to the department, the IIC, as she explained, and as well as the ATC that we forgot to throw on here. The ATC is our air traffic control department, who is assigning reads out 24/7 as well. They're assisting the radiologists in the read rooms to make them more efficient. We have hired locums to bridge the gap between the hiring, the onboarding, and of the new radiologists. There's been incredible support from high leadership in getting whatever we need to help get the reads done. So please utilize the IIC for any urgent needs you have related to patient needs and getting a study read. But I just thank everyone for their patience. We know, we understand, and know that it is a priority for us.
Thank you, Cheryl, for that. I think the slide you're missing, Kylie, is actually after the discussion side. Is it the one with the resources?
Yes, okay.
Yeah, we still have that. So there are two questions that I have. One is specific to urgent cares and getting images or results back. I've gotten some questions back from some of the groups in the community. What's the best way for them to access imaging results from urgent care and other offsite imaging locations if they're not on Epic re-record?
I think the IIC would be the best course of action. And I think Kylie's going to, I think I saw in the chat, somebody requested the IIC phone number. Kylie, do you have that in the next slide? Do we have that as part of our materials?
Yes. I have, I don't have the phone number posted there, but I will put it in the chat right now.
And the other question that I had too is, are there specific delays that people should know about, like if they're requesting certain types of imaging that are longer than the rest?
Yeah, that's a great question. Our cross-sectional imaging is taking a little bit longer to be read because we did have some physician turnover in that area. So our CT and MR studies are taking a little bit longer. Your x-rays, your general diagnostic imaging are turning around a lot faster. Ultrasound is turning around pretty quick. It is the cross-sectional, more complex studies. We did have, we lost Dr. Yun in the region, but we did gain Dr. Mir. So we've had some comings and goings as well. So I would just know that if it's a CT or MR or PET, to let everybody know, don't sit. I have no issue, and the IIC knows those calls are coming. So feel free to call and ask for that to be read ASAP.
Any questions from the group that haven't been put into the chat? No? Okay, so Kylie, I will advance to
Okay. So I wanted to mention some reference materials that Jana will be sharing after this meeting. The first one is the Imaging Sciences Access Guide, and that is a complete list of all of our different locations and which modalities are offered at each of those locations. Then we have the AVIR record. So this is our Affiliate Vascular and Interventional Radiology group and what services they offer. So, and which locations and how to access those services. In addition, we have two different mammo guides. One is for screening locations and the other is for diagnostic locations. And then we have our lung cancer screening guides. There's one for providers to basically tell them how to refer into that program or just to use some of the information on there if they need it. And then we have patient-facing lung cancer screening guides, and then the IIC contact information. I did put that phone number in chat if you, just in case you missed it, it is there. And then next slide. You can always call myself, reach out to myself or Cheryl. Our phone numbers are right up there, as well as our email addresses. And Jana, if you're able to maybe share those with the group as well, when you share the different reference materials, that might be helpful.
Yes, if you're okay, these slides will go out in the follow-up, so people will have the deck.
Excellent, great.
I'm sorry, can I just add one more thing about the types of imaging that might be delayed? The mammography screens, it is definitely something that we are a couple weeks out on. Dr. Harvey has hired a locum to help get us through until the new hire starts later in July. And I know they're putting incredible effort around mandatory moonlighting, a lot of efforts on the nights and weekends by the faculty, but we do have, so in the mammography department, we did lose one provider and then we have two out on medical leave. So that's why we are falling a little bit further behind in the mammography screens right now, but a locum did start over the weekend.
So thank you all for having us today. And again, if there's any questions, you'll have our contact information. Please feel free to reach out. We're more than happy to have more detailed conversations in any of our imaging areas.
Yep, appreciate your time. I know you guys have a lot to discuss, so.
Yes.
Thank you for joining this morning. As I mentioned, if you have questions, you can definitely reach out to them directly with their contacts. Obviously, if you guys know how to find your folks here at AHP, and we can be assistive in whatever way we can. So we're turning it next to another outside group who we're happy to have as part of our AHP team, really, to Medline. So we do have some folks from Medline. Mary, you plan to run your slides, correct?
Yes.
So I'm going to stop sharing my screen and let you guys take over, but Mary's going to introduce her team and get us going there.
Perfect. Thanks so much, Jana, for the opportunity. I wanted to introduce myself, Mary Kozik, the Strategic Account Manager with Medline in the Northeast, and I oversee the University of Rochester relationship. As being an affiliate, I wanted to go through some slides that Medline is able to offer your practices today. So bear with me while I pull up my slide. One sec to share a screen.
While Mary is doing that, here is your second alert of the meeting that if you have joined since we started, please put your name and practice in the chat so we have that for attendance.
Can everyone see my screen?
Yes.
Perfect. So why Medline for Accountable Health Partners? Who is Medline out there in the market? Medline is a privately held company that services the whole continuum of care. I have on this call also Sarah Niemiller, who is our National Account Director and helps oversee all of the relationships for our large groups across the country.
Hi, good morning, everyone. Appreciate the time. Thanks for having us.
For the physician's office piece, we, as mentioned, cover the whole continuum of care and how we could help your sites. Inventory management, putting together formularies, logistics. We have a supply chain optimization team, how we can get those supplies desktop delivery to your end users today. Medline is a manufacturer and we are also a distributor. We have over 500,000 products that we distribute today. Of that 65,000, we are manufacturing across the world in 8 different countries. And how Medline can help your sites reduce overall cost. Some of the key differentiators from Medline outside of other suppliers and where we shine, we are the leader when it comes to exam gloves. I know this is one area that is always the highest cost for the physician's office side. PPE, protective apparel. During the pandemic, we brought resources to the US. Now we're manufacturing masks and gowns domestically. Medline started out as a textile company. So any area where it comes to EVS supplies and scrubs, if you're looking to standardize in that area, we're able to assist. We are also able to look at your overall spend, help build custom trays. That's an area Medline also shines in. Surgical gloves and respiratory products, and DME. One of the areas too, Jenna, when you mentioned Guthrie, I've been with Medline a little over 12 years. And in my old world, I came from our long-term care side and I live in Pennsylvania and serviced Guthrie and worked very closely with the home health and hospice piece. So we sell products that ship right to the patient's home. And Lords as well, I worked with quite a bit. Supply chain reliability and resiliency. How is Medline able to help get those products just in time to those end users? Today, Medline has over 50 plus warehouses across the country. We ship out of B36, which is one of our New York warehouses, but also since the AHP partnership is spread out through the state, through New York and Pennsylvania now, we have 3 warehouses that you would be able to piggyback off of to have supplies shipped for next day. So we have our B36 warehouse, we have our C54 warehouse in Montgomery, New York, and then our C47 warehouse, which is another hub in Perryville, Maryland. So those 3 warehouses would be able to help get supplies next day. Also, we have a few different areas that we're able to help assess your day-to-day, and through analyzation and implementation, we can look at your spend, areas that you guys are having issues with sourcing today. We'd be more than happy to look and put a plan in place. One of the other things is we have 2 dedicated local reps in the New York area, and then we have 2 additional reps that you're over Guthrie in Pennsylvania that could help come out and meet with your sites and put a plan in place. Product standardization is what we hear a lot of, that physicians' offices are looking to move forward with. And how do we get there and how do we achieve that? Through analyzing your overall spend, Medline is able to help look at different categories, as mentioned, where we're the leader in exam gloves, PPE. We also work with lab. Medline is a lab partner for you all. We also are a pharma distributor. We don't do the controlled substance, but we ship right out of our C54 warehouse for next day shipment with a lot of pharmaceutical items that your sites would use today on a day-to-day basis. We could also look together if you're using over 500 different SKUs, how do we help standardize? And one of the most important pieces I would like to discuss is, as mentioned, Medline is a manufacturer, but we also distribute. So on the Medline branded side for the gloves and the PPE, we could piggyback off of the pricing file for University of Rochester today and pass along those savings. From a standpoint of savings, what it might look like for you is a 10% savings on Medline brand. Also engaging with each of your GPO partners, making sure that you're rostered properly and helping you guys identify contracts that you might not be aware of today on those national brand items like a 3M, Kimberly-Clark, Smith & Nephew. So we have those capabilities with our prime vendor analysts today. And formulary development, as I mentioned on the previous slide, just a lift and shift. And if you guys are looking to see what our partners today with AHP, we have 40 sites that are actively ordering with Medline. I do want to mention it's not an all or nothing piece. Medline would love to help you out in different categories if you're struggling. I know I've recently spoke with Jenna and Rob on some pharma having issues sourcing. So lidocaine, epinephrine, you know, if you wanted to start small with Medline, that's definitely an area we could assist with and building out different formularies. We also have a lot of reporting capabilities. So on a monthly basis, if you want to see where your spend is at today, we're more than happy to set up those reports for your team. Outside of formulary development, just a simple medline.com ordering platform, giving your sites access. I also have given Jenna and Rob access to all of the AHP sites today. So they've been helping and assist with allocations and looking for different subs. Medline has a very robust portfolio and a lot of different features on medline.com that houses our 500,000 items today. You'd also be able to see what tier contracts are accessible through your GPO invoices, MSD sheets. If you're familiar with Amazon, which everybody is today, very similar to search features as well on here. Any questions before I continue to move through who Medline is today and how they could help partner with you all on your sites and help reduce costs? All right.
Nothing in the chat.
All right, perfect, thanks. As mentioned too, data transparency through our monthly reporting. Contract compliance is big, engaging your GPO partners, making sure that we are accessing every contract, looking at KPIs. What are you doing today? What does Q3 and Q4 initiatives look like for you? And how does Medline help partner with you all and achieve that? Setting metrics, you know, do we want to reduce our formulary by 10%? What categories are we looking to save on? So just different areas Medline is able to help through our data team. And this is a quick snapshot of what our AHP partners are doing with Medline today. I really like this report. It's our heat map. It's just different categories that Medline is working with our partners today. And I removed out the sites, but you could see, you know, if I was this site and I'm spending $42 in gloves, what are the other sites from AHP buying? How do I standardize and find the best cost glove for my sites? We have probably 100 different nitrile SKUs. Which one is the stocked one that arrives next day for our best costs? Advanced wound care, as mentioning earlier with Guthrie and Lords coming on board with AHP, we did a lot. Medline has 7 dedicated WOCNs to our team. So they have helped build best practice guidelines, looking at longer wear times and reducing the costs there. What do we have in our portfolio? We also have, on top of the 7 WOCNs, we have a dedicated hotline. So clinically trained, help you out. And especially for those rural areas that it might be tough to get somebody into provider right away, we have those resources available. Also, we have PT supplies, a robust respiratory portfolio, and then these are just some of the categories that the AHP sites are buying from Medline today. And then the top 20 materials that are being bought by AHP. Medline is a flu distributor. So right now, you know, we are booking flu pre-book. So if your sites haven't booked today, that's something Medline is able to help assist with. And then you could see also influenza testing. We are approaching respiratory season in August. So we work with the BDs of the world and the Cepheids and the Sophias. So if you're looking for analyzers to bring in testing on site versus sending it out, we have those capabilities as well. And we have a dedicated lab specialist that could work with each of your sites to see the different options and looking at reimbursement. What are we getting reimbursement today? How do we maximize that reimbursement and get results to our patients just in time so we can treat? And then just to wrap it up, these are just some of the Medline partnerships in the Northeast. Obviously, University of Rochester, and we're looking at the New York sites. We have New York Presbyterian, NYU, Sinai, and we do work with Guthrie and Lourdes with their health systems today. I'm going to open it up to see if there's any questions, and in the chat, I will put my contact information. If you're looking for Medline to help come to your site, do a deep dive, show savings, more than happy to deploy our local reps out to you.
Thank you for that, Mary. And while folks are putting their questions in the chat and coming off of mute, I did just want to mention to the groups, the folks on the call, really AHP pursued this partnership during the pandemic where people were having a hard time sourcing some specific items. And the groups that have since joined have found that, there is significant savings here in this partnership. And so while it's not an exclusive opportunity where you do not have to switch your entire book of business, a lot of people have moved, the majority of their purchasing to Medline. If there are any practices on the group who are utilizing Medline and want to speak to their experience, that would be great. Another thing too is you may not see Jennifer Taskin, who was one of our primary reps on the account here as Jennifer left. And I'm sure your Medline teams have been in contact with you about the transition for Jen. But we've had a really good time, and Bob and I working with this new team are, we're excited about the opportunities here to continue to find different ways to streamline some of your purchasing and buying and bringing you some savings there. So if you have questions, go ahead and ask, but I just wanted to make sure Bob.
I appreciate that.
Yeah, no problem.
Yeah, I just wanted to echo what Jana was saying. Working with Mary has been great, and she's been really hooking us up with some new tools. So we would love to partner with some practices to kind of test out some of those tools and see what we can do with them, and find ways that help out, that we can spread the savings to the group.
Thanks, Rob. Thanks for that too, Kelly. I just saw your message in the chat.
Thank you, Kelly.
My contact information is in the chat. So if you would like to reach out again, we could set up some time. I've worked with some of the PED sites and done some Zoom together to look on medline.com and just help explore different options.
Okay. Thank you so much, guys.
Thanks, everyone.
You do not have to stay on the call, but
Okay.
you are welcome to do so.
Have a great day, everyone.
Appreciate the time. Thank you.
All right. Thank you all. I do not have to share my screen again because we're moving into clinical initiative updates, and Elizabeth Sharp and Kevin Kelly will be presenting today on the breast cancer experience. So I'll let them take it away.
Thanks, everyone. So I'm Elizabeth Sharp. I'm the Director of Clinical Operations and Quality Improvement at AHP. Kevin, you want to introduce yourself real quick and then I'll jump in?
Hi, Kevin Kelly. Good morning. I'm the Project Manager of Business Operations at AHP.
Thanks. So we wanted to touch base with you all very briefly today about breast cancer screening. But as you'll see, the title of this project, or the title of this presentation, is the Patient Experience Project. So a slightly different viewpoint and a slightly different reason for engaging with breast cancer screening. It's still on our quality grid, still a core measure. Nothing new in that space, but I wanted to peel back the curtain a little bit and explain to you all where this sort of new perspective is coming from. So Kevin, you want to flip over to the next? So I am kicking us off by talking just a little bit about our Excellis Quality Program. We actually, for 2024, in our Excellis Quality Program, we have 3 different components in that program. So there's the ambulatory grid, that's our quality measures, what you guys, it's near and dear to all of our hearts. We have our quality improvement project, which we've had for a number of years, which has been depression screen and follow-up. You guys have heard me talk about that ad nauseum. And we have a patient experience project. We have chosen access to specialty care breast cancer screening. And I'm going to walk you through a little bit of the history if you want to flip to the next screen. So this is a 3-year project, but you haven't heard about it before now because a lot of the work was being done behind the scenes. In year 1, which was 2022, Excellis did a survey, much like a Press Ganey survey, to better understand their member experience. In 2022, year two, which was 2023, we partnered with them to take a look at our data. We had some questions about the survey. They were going to redo it. And we started to focus in on breast cancer screening as a possibility from an access to care perspective. And this year, we have really decided that that is what we want to engage on. We chose breast cancer screening for a number of reasons. We're already working on it as a network. Our data coordination and data analytics teams are already really engaged in it. And we know it's important. It's been on our grid for ages and ages. And we even have people from Imaging Sciences coming to talk about it in the same meeting where we're talking to you about this. There's one other reason why we wanted to focus on breast cancer screening. Kevin, if you could go to the next slide, and then I'm going to let Kevin take off with actually what we're doing. If you take a look at this, what you're looking at here is commercial, Medicare, and Medicaid. So when we look at our contract performance, we look by line of business. And that is going to be the way that we're looking at our quality measures for 2024 for the network, simply because of the data consistency that we want to be able to provide for this year. So when we started looking at this, you'll notice that we had closed 88% of our breast cancer screening gaps in commercial. We'd closed 88% of our breast cancer screening gaps in Medicare, and only 70% in Medicaid. That means that only 70% of the eligible women on the Medicaid plan had received a mammogram in the previous 2 years. So there's an equity issue at play here. That's something that's really important to AHP, and it sort of lent additional weight to us wanting to address any access issues that we might see in this space. So that's just a little bit of context for why we're talking about it and why we're talking about it in this way. With that, I will hand things over to Kevin to share a little bit about the work that's being done.
Thanks, Elizabeth. I'm Kevin Kelly again. Nice to see everyone this morning. I just want to help facilitate and connect anyone interested in getting our patients screened for breast cancer screening. Thanks to Kylie and the UR Imaging team for mentioning the Mammo Van, and I just wanted to elaborate a little bit more. And like I said, just connect anyone interested in any way. You know, you can take down the Mammo Bus, the Mammo Van website. You can host at your practice. You can connect patients to the Mammo Bus, or you can hand out brochures to the patients. So I just want to walk through that. And I just wanted to show the website first before I go to the next slide. It's a very, very nice website with a lot of resources. So basically, the patient can make an appointment, request an appointment, and they can get back within a few days. There's the event calendar, which today there's actually the Mammo Bus will be parked outside of Corporate Woods. So they are busy, and these are the rest of the events the rest of the week. And then again, another call to action to request an appointment, and then frequently asked questions, which touches on basically all these FAQs are in the brochure. So please, if you're interested in the brochure, put your practice in the chat, and I will follow up, and I will also provide my contact information. And I'm not sure how many brochures you're interested in, but I can connect with the Mammo Bus team, and I can mail them directly to you or drop them off. So please, if you're interested in brochures for your patients, I am happy to facilitate that. And then down here at the bottom of the website, there's these PDFs of the actual brochure, which is basically all those FAQs I just talked about, and then the flyer, and then kind of what to anticipate if you want to host the Mammo Van. So those are all the resources on the website. And again, please feel free to put your practice in the chat if you're interested in brochures, and I'll help facilitate that. So a little bit more on scheduling the Mammo Van events. Great news, there are no fees. So they are pleased to inform you that there are no fees involved in bringing the Mammo Van to your organization, which is amazing. And if you're interested, you can either reach out to me and I can help facilitate, or the email address is right here. And the phone number is right there as well. And you can expect a response within 2 business days. If there's no questions, I will keep chugging along. So this is just a brief, who is eligible for a mammogram, at least 40 years old, have not had a screening the last year, not pregnant, and if there's a patient who's concerned in any way about their breasts, that's who is eligible. And then this is just for your patients if they need to connect outside of these coordinated events. Again, the same phone number and the email. So if there's no questions, like I said, please feel free if you're interested in brochures or if you're just interested in scheduling an event in any way, I'm happy to help connect and facilitate that.
Thank you. Elizabeth, looks like you want to say something.
I was
And I
just
saw
gonna
Kylie
say-
come off also, so we'll do a
Yep.
1-2.
So we're very excited, obviously, to share information about this new resource. It doesn't necessarily replace all the old resources. So you still have access to U of R imaging and all of the other imaging sites available. The key here is we want to make sure that patients are getting in. So if you are having trouble, please feel free to reach out. If you are looking for patient lists, please feel free to reach out. We want to support you all in this work. We know you talk to your patients about it already. As I said, this has been a core measure at AHP, and we know across the network for a long, long time. But we do want to make sure that we're dedicating the appropriate amount of attention to it, particularly in light of like the additional perspective we have with this patient experience project. So if anyone has anything that they want to share either here or offline, we're more than happy to connect. We have the resources available to help dig in with you if you have questions or issues. So please don't hesitate to reach out to Kevin or I with anything you may need.
Thanks, Elizabeth. Go ahead, Kylie.
I just wanted to add too that we work very closely with Cancer Services. So if you have patients who may not be insured, we can get this screening to them free of charge through New York State funding. So just wanted to
Thank
add
you,
that.
Kylie. I was
Thanks, Kylie.
actually going to mention, so before you all knew me at AHP, I actually worked for the Cancer Services Program on that grant that Kylie just mentioned. So this, the Mammo Van is a great opportunity for people, and they partner with the Cancer Services. So many of your patients will be insured, but for those who are not, there is opportunities for them to be screened as well. The other thing is people are usually very hesitant about the Mammo Bus because it feels like, oh, it can't be as comfortable as going to a nice facility and having the screening there. If you have not had a chance to get on one of these mobile vans, they are remarkable. They have done a really good job of making them very comfortable and patient-centered. And so, those fears can be wiped away. And if you do ever get a chance to get on one of the vans, I encourage you to do so because they are lovely. Are there any questions before we move on to the very final section of the presentation? I didn't see any in the chat, but okay. What I will say before I pop my screen back up is, as Elizabeth and Kevin just brought us back around to our quality program, we did plan to have Q1 a performance for today, but as you can see, we had a very packed agenda. And in talking to Elizabeth through that, what we've determined is that maybe the best thing to do is actually kind of like a lunch listening hour for when we roll out our Q1 performance. We've shared in the past that it's going to be a little bit of a different format and view for how we've done that previously. So we want to make sure that people have a chance to get acquainted with that. So we will be finding some time during the lunchtime hour just to sit down. People can pop in, listen to what we have to say about quality performance and, kind of introduce that topic. If that works well and it gets people acquainted with the new format and it's a good way for people to engage and interact, very light touch, we do plan on continuing that for the rest of the year. So long as that's well received and is working. So of course we'll continue to share that information in other formats, but for this first one we thought let's give it some focused time and attention, so we're not rushing through that and people have an opportunity to really sit with the information. Okay. So I will go back to sharing my screen here to touch on our last topic for the day, which is upcoming incentive payments. It's the thing that makes everyone very happy when we talk about our dollars. So our team is working closely with Jim on getting those first quarter 2024 clinical integration dollars out the door. We expect to be able to do that later this month, if not the first week in July. But we do have a hard cutoff because Jim is going to be out a little bit. So we will be working towards that goal through the end of this month. We also are going to be making plans to distribute the 2023 PCP reward plan in the August-September timeframe as we did last year and will continue to do. This is a change in timing from previous, reward plan structures. So we do pay out the last year's performance reward plan in the summer, fall of the next year. Are there any questions or comments on that? It's a very quick slide, not much there. Okay, it's a status quo. I do want to open the floor to discussion. Any specific questions that we didn't touch on today, they don't have to be related to topics here. As I mentioned, you can throw those out, and if we can't answer today, we can definitely bring those to a future meeting or get back to you via email. You can always send questions, comments, anything that might be helpful to discuss in this setting. You see, we can procure some speakers on topics that are timely and relevant to your needs. So, always feel free to do that. But I'll stop talking for 10 seconds and let people ask away. Okay. Having no questions. Thank you. We've made it through half of the meetings for this year. As a reminder, these do count towards your practice's citizenship for 2024. So your attendance at 2 or more of these meetings can help all of your providers in the practice obtain their citizenship reward for the year. Our next meeting is going to be in September. So this is our last meeting before summer season kicks off in good fashion. So we hope you all have safe, happy summers. And we'll see you back here in the fall on September 18th. Before I release you, wait, I do see something in the chat. Oh no, just the name. Before I release you, yes, we're an AHP practice. Please remember to say this, and when people call, that your staff knows this. This means that your patients should be referred to AHP specialists whenever possible, be seen at AHP hospitals whenever possible, and use AHP imaging and labs whenever possible. If you have a question about who those people are, you can always reach out to us, and we will find some ways to accommodate and help you with that information. For your practices, monitor Arcadia. Oops, I forgot to update that because Arcadia is now turned off, but the PER is still up and running. If you guys have questions about the content there, please reach out. Continue to attend these meetings, accept, read, and share our communications. They are well received and well liked, especially Pharmacy Pearls. And then, of course, help providers connect with any AHP resources that might be valuable for them in their clinical practice. As always, I will include contact information for the folks here at AHP. But with that, that's all I have for you. So I'll stop sharing my screen so I can see all of your lovely faces before we depart for the day. But thank you for joining us, and have a good one.
Thanks, Jana.
Jana.
Yes, I see a note here from Kat. Bye. LJ, are you going to stay on with me, or oh no? Gotcha. All right, Kathy, we will work on that and get it to you. Any specific specialties thinking about?